So the take home from the reports are not only dietary changes, lifestyle changes, but also probiotic, nutraceutical, vitamins. Is that kind of how deep do you go in your recommendations?
Yeah, so we focused on food first, food and diet, and we do a lot of supplements. We don't make supplements, we don't make these products. We're not
Right.
identifying like brands right now. We're not saying
Hmm.
try this brand. We're saying certain probiotic strains or certain vitamins, and
Yeah.
letting the provider or the consumer kind of make those decisions. But yeah, I think there's also a lot of studies on lifestyle, even like certain exercise. I've seen a lot of papers on acupuncture as well. Seems to be a big impact on the microbiome. So that's one of
Oh, wow.
the lifestyle incorporations. Yeah, intermittent fasting also comes through a lot.
Mhm.
So that's the realm that we are operating right now with the food, lifestyle, supplement changes.
Although there is a
So,
literature also on medication, and not only in terms of how medication can impact your microbiome, whether it's aspirin or metformin or whatnot, but also that certain microbial states are predictive of how effective a drug is going to be, particularly in
right.
oncology drugs and biologics and GLP-1s. So there's actually a fair bit of literature on this to not only associate somebody's microbiome with drug response, but also how drugs are going to affect somebody's microbiome. Today, we're not
Yeah,
providing that information, even though there's studies on it, because we want to be very careful about doing anything that might cause any kind of concern. And we want to just be careful in releasing that information. I think we will eventually
sure.
provide that information to doctors and providers so that they'll have it as they go about figuring out how to manage to their patients.
Yeah, that's great. It's been really helpful just to even hear that when people are non-responders to certain medications, that to look at the microbiome for clues for why, and just to even know that's a link has been really helpful.